everybody. Welcome back to Pelvis Party. My name is Becky Monpetit. I am the owner of Rochester Local, and I'm joined by my friends, the original Pelvis Party crew. We're back.
Good.
We're back together. The gang is back together. So a couple of introductions. This is Britt Marshall with Marketing and Communications at Olmsted Medical Center. And this is Dr. Melissa Richards. She's the Division Chair of Hospital and Surgical Services at Olmsted Medical Center. Welcome back, my friends.
Thank you. It's good to be back.
It's so good to have you up here, Britt.
I
So
know.
nice.
You're in the hot seat too, right
Yeah,
there
I
in the
love
middle.
it.
I know. Well, we're going to talk about something we've talked about before, but we want to talk about it again because it's important. You have your wellness exam.
Tomorrow. So it's very timely.
So exciting.
Tomorrow. So we're going to talk a little bit about wellness exam, and you've got questions.
Mm-hmm.
You are ready.
I always come with a list, so I'm happy to share what my list might be, and then talk about what do you cover, because I'm not even sure all of these things are
true.
things I
Like,
should talk about.
Do you talk about this? Do you talk about that? Should I wait to see? Especially, what should I do?
Mm-hmm.
Right? So you've got your list of questions.
Yeah. And annual exams, you wait, and then if you're like me, you kind of wait. Should you wait? No, that's the thing, right? Don't settle.
Yeah.
But I've waited, and so I've got a list of about 10 things that I want to talk to my primary care provider about. So I have the ongoing back pain.
Yeah.
Mm-hmm.
That's always there. It's kind of dull and suffer through it, but I see a chiropractor, so I just want to talk about, am I getting better? And should I be going to PT maybe, or physical therapy?
Yeah.
I have a toe that's a little weird lately, so I want to talk about that.
A weird toe.
Yeah, I think the toenail might come off at some point in my life.
Oh.
Not this week, and I don't like feet either. It's a gross topic, I know.
Ew. Yeah. No.
Podiatrists are the bomb. They're so great.
Right. I know.
People work with feet.
Yeah. Right.
Great people.
Well done.
Yeah.
Yeah. Great.
Mm-hmm.
So okay.
Yeah, and why I choose that profession, that could be a whole
They
other
love
episode.
them. It's great.
I know. Great for them. Okay. So weird toe.
Yep. I have this post-nasal drip thing going on. I have a spot on my arm that I'm a little worried about. Maybe get that checked out. You see it?
Oh yeah, that's a derm. That's gonna be a derm. Follow up.
I have a sharp pain in the muscle. Sometimes when I move, getting in and out of the car, between the bottom of my stomach and what's the proper word for the fat on your the top of your vagina?
Your mons.
Mons.
Mm-hmm.
I clench my teeth at night. I grind, and I'm wearing through my retainer. I have an IUD like many women, and my periods every single month are different, and I should be done right now, and I'm still spotting.
Mm-hmm.
Oh, that's a good question because I have that question too. So you're asking for both of us. Well done.
And then two recent things that just came up yesterday. I had a really stressful day, and you can't tell now, but I had a huge hive right here.
Stress.
And my eye was twitching. I'm am I low on magnesium? I started Googling. So there's my list of...
That's quite the list. What do you think?
So what I love about this, I love this so much. So this is a great opportunity to level set what a well exam is.
Yeah.
So who does well exams? So typically internal medicine, docs will do them for adults.
Mm-hmm.
Family medicine people will do them for kids and adults of all ages. And then pediatrics will do them for kiddos or even up to age 26, depending on the clinician. And then OBGYNs also do well exams. Most well exams are about 30 minutes.
30 minutes.
30 minutes.
That's fast.
So you're
I
gonna
don't think all of those things could be answered.
So coming into when I have so you would check in, and you will check in, and then they'll get you all settled in, and then bring you some either a nurse or a medical assistant will come and grab you typically, and we'll get a height, weight, they'll check your blood pressure, your vital signs, and then they'll ask, so you're here for an exam, and sometimes they'll ask do you have a list, or what do you got, and they'll write things down, and then sometimes the nurse does, or the person checking you in, sometimes the clinician, they'll go through you have an agenda, I have an agenda. How can we bring these agendas
together? Yeah.
Yes,
okay.
because my agenda when a patient comes in for a well exam, and this is such a good episode because a well exam is just that, it's well. So it should be focused on making sure that we're hitting all of our preventative issues. So I'm going to focus on that.
Mm-hmm.
So updating your medical history, your surgical history, your social history, what's going on in your life, your family history, because all of these things play a role in how we make recommendations moving forward. So after we do that, we can kind of talk about, okay, are immunizations up to date? Are there recommendations when we go through screening things, like talking about alcohol use, drug use, tobacco use, and talking about wellness from that perspective? Thinking about, like, are you due for labs? What blood work could expect to do? What you're trying to figure out is, from a screening process across the board, what screening things do we need to think about today? And then also, what makes you special?
Yeah.
What makes you special, and what screening, because you fall into a special patient population, would we recommend?
Yeah.
So, we start cervical cancer screening or pap smears at age 21. We stop around age 65. We talk about breast cancer screening that typically starts at age 40 every year. We talk about colon cancer screening. A gold star is starting at age 45. However, all of the things that I just brought up, in certain patient populations, they're a little bit different.
Right.
So I, in my head, have all these health, like, screening wellness things to talk to you about. And like most people, we're all really busy, and we're also, like, healthcare, there's the financial issue with it too, right? So, we're really busy, and we know that each of these visits, a lot of patients think of their well exam as the free visit. So I think thinking about, like, we have all these clinician things that we want to hit up. We have patient, because we haven't talked about anything on your list. And then some type of exam is likely supposed to happen somewhere built into that. And we're going to do this in 30 minutes. That's why, can I just, a big shout out to, like, please, especially if you have a well exam, we tell you a check-in time, come at your check-in time, because your check-in time is just a little bit before your clinician time. And if you come at your actual appointment time that's with me, 15 minutes of your 30-minute visit is going to be working with the person before me. And now I'm down to 15 minutes to get through all of these things.
Yeah.
So, and updating, that's the neat thing about MyChart. So you can update your list. I would say most clinicians, we go through our portion and then we really look at your list, right? And, like, okay, how can we strategize here? Because there are things here, there are some things that we really need to look at, like your hand, like the
spot.
mark on your hand. Like, that's something good job, Becky. Get you to dermatology. And then kind of come up with a plan of attack almost. Because we're not going to get everything done on that list, but we're going to put together a plan. My goal when I see a patient for a well exam and get this list, first of all, I take a deep breath, because it's very easy to get overwhelmed. That list, I would tell you, up until maybe 2 or 3 years ago, would be very overwhelming to me as a clinician, because I want to fix everything at one visit, because I know time is important. But now I've got, like, we're going to do the best we can in this allotted period of time, and we're going to do the best we can. And that's fine. Like, let's triage out what's most important, but then what's second most important when you leave, that we've got a good plan. I want you to feel, like, empowered, like, okay, well, I still don't know what to do with my low back. But we have, like, maybe we need to do a follow-up visit. Now, wellness, most insurance does cover a wellness exam, but there are things built into that sometimes wellness exams do turn into a problem visit. And that's where things can get a little tricky with insurance and with billing. And so, just understanding that your insurance will definitely, I love how I'm talking about insurance as a healthcare clinician. It's quite aggravating. But the wellness portion should be covered. But when we start talking about problems, and if we get into them, there are different things from a billing perspective that you might find yourself with, what you wouldn't have known might be billed as part of outside of wellness. But at the same time, we need to take care of ourselves. So these things do need to be addressed. Everything on your list that you have are things that need to be addressed. They're important things. We talk about, like, labs, like lab work to be done. Typically, as an OBGYN, when I think about wellness, if you're what we would call, like, a low average risk person, I don't typically start doing labs until age 45, and that's typically checking your cholesterol, because I'm thinking about heart disease. I'll test for diabetes, as well as thyroid. If someone's still having periods, like not with an IUD or something, or have a hysterectomy, if she's having regular periods, I oftentimes will check your hemoglobin, just because people say, oh, my periods aren't that bad. And then I check their hemoglobin and it's like 9. I'm like, tell me more about those periods again. Well, I'm changing a pad every hour and whatnot. And I feel like I'm gonna pass out. Oh, okay, but they're normal for me. And let's walk our way through that. Let's talk through it. Wellness exams can start at age 13. And forever, basically. I will always want wellness exams to feel like something that I don't want to feel bad if I haven't been in for like years.
Yeah.
That's a common thing.
Yeah, sure.
Right?
Yeah. So you like build up this list of after years of not going and you want to get through it. Right. So it sounds like from your perspective, you've got your list. From your perspective, you've got your list. So I think a really great what's coming out of this episode is that as patients, we need to understand that there are certain things that also need to happen during the wellness exam to make it a wellness exam. But that doesn't mean that your issues shouldn't be addressed.
Absolutely.
And so work through the list and, maybe a follow-up is necessary, or maybe MyChart. That's where MyChart comes into play, and you can send, questions through to your physician that way. I don't know.
And I do that sometimes too, but it's kind of like I'm having a flare up today. Like, let's talk about my back. I'm having a flare up today. What do I do? I'm not like on any pain meds or anything like that, nor do I really want it.
Yeah.
But I could use an extra visit at the chiropractor, whatever that might look like for me. But it's kind of like, I sent it off, I forgot it. And then I'll go check later and it's like, oh, this is already gone. So I almost like wasted their time because I was in pain in the moment, and then,
Sure.
So it's like it's a balance, I think, of
Absolutely.
me being responsible for my health care, also advocating for myself through that mechanism. Because MyChart is so good for that too.
MyChart is amazing.
Usually pretty timely responses, and sometimes it's from the nurse, sometimes it's from the practitioner.
Right.
And I think this is a good time to talk about virtual visits too.
Perfect, Becky.
Right,
Perfect.
because virtual visits through OMC are amazing, and they're oftentimes on demand. So you can log into MyChart, you can click a virtual care visit, you get entered into a queue, and wonderful Amy
Amy Nelson, fantastic.
Amy Nelson, she
Tag
is
that
going.
episode.
Yeah, she is going to. We have a whole episode with Amy, and you can say, "Hey, I have this," and she can then recommend. Hey, I think you need to follow up, or let's get you to this person. And they're so convenient because you're sitting at your computer, and she can get you to the right follow-up person that you need to do. Or maybe it's something that she can handle herself because she can treat and prescribe for lots of different things. So it really is the scenario where we've got lots of different things available to us in tools for advocating for our health, wellness visits, MyChart, virtual care, it's about addressing each one of those needs in the way that you can through the tools that we've been given through OMC.
And we want you to feel validated. That's the big things. I've become acutely aware that when you're coming in, especially if you haven't been in for a while, that's me. If you haven't been in for a while, what it took for you to get to this appointment, what it took, what rearranging you needed to do. Understanding that, and then putting into motion a plan that feels really good, that you don't feel dismissed. I would never want a patient to feel dismissed because we only met my agenda needs. We can meet the needs of both agendas. It's going to be creative, and it's great. And that's why it's a partnership, and that's why people choose to obtain health care at Olmsted Medical Center, as well as give care at Olmsted Medical Center.
Love it.
That's so good. I think it's a good piece of awareness even for myself. I have this list because my day's stacked. Like getting to my wellness exam, I've like buffered my hour in between just to make sure I get there on time.
Yes.
I do the paperwork and all of that.
Yeah.
And then I've got a list because I want to talk about those things, and I can't call or get in every time I want to just because of my schedule.
Right.
But doesn't mean I shouldn't.
And I love too that you have a list. I mean, I think it's really great for other people to hear and see and know that another person has a list, because sometimes you think, oh, but it's important for you to list out anything that that's out of the norm for you. And so it made me feel better with the note that I have on my phone. Mine might be a little bit longer than yours, but that's okay. But I do get stress hives. I used to get stress hives. So
that was my first one. It was very bizarre. I was like, what is happening? And it just kept getting bigger. As the hours went on last night. Then I woke up and it was gone.
Maybe it was like the extra pollen in the air too.
It could have been.
Yeah, who knows?
You guys should maybe talk to a doctor.
If
Don't
only
ask me. I'm an obstetrician
If
gynecologist.
only there was one in the room.
We'll talk about your vagina.
Sure. Real expert there.
Real expert
Well,
there.
this was a good episode. Thank you so much for sharing us with your list and talking through it on the clinician side. And as always, if you like what you see here and you want to know more, head to rochesterlocal.com/pelvisparty.